Guess what? My mom recently decided to go on a solo mission to Beijing to get dental implants. Brave move, right? Well, one fine morning, out of the blue, I got a frantic call from her. She sounded all panicky, saying my blood pressure shot up to a whopping 190. I swear this dental clinic is out to get me. I'm stuck lying down and can't move an inch. I desperately need something to calm me down, bring my blood pressure back down to earth. Any ideas?
Welcome to Eat, Play, Heal with Yoki. In this video, I share my personal experience and insights. I recommend trying these techniques as complementary therapies. However, if your condition is severe, please seek timely medical attention.
Today I want to share with you the bizarre incident my mom encountered during her dental visit in Beijing. My mom chose a dental clinic that is supposedly a German brand. When it comes to picking a clinic for dental implants, it's not just about the nifty technology and materials they use. What really matters is top-notch services and a professional attitude. Dental implant procedures are not like simple treatments. They involve a lengthy process. From tooth extraction to healing, suture removal, impressions, and finally the adjustment of the prosthetic teeth. And let's not forget about the lifelong follow-up appointments and warranty. It can take up to a year or more just for the dental implant process, with plenty of potential unexpected situations along the way. In my mom's case, she had a scary incident where the healing abutment suddenly came off while she was eating and required immediate attention. Many people are afraid of going to the dentist. Dental anxiety is a real psychological condition. It is referred to as either dental anxiety or dental fear, which encompasses a range of abnormal psychological, physiological, and behavioral states related to dental treatment. Believe it or not, up to 90% of patients with oral issues are affected by this fear of treatment. When someone battles dental anxiety, their dental visits can turn into full-blown panic sessions. They might feel like they're losing control, experiencing rapid heartbeats, abnormal blood pressure, sweaty palms, speech stutters, tense muscles, pale complexion, or, in extreme cases, even fainting. Now, imagine if you are one of those individuals with underlying hypertension. The mere thought of tooth extraction or dental implants is enough to make you want to escape. Those situations call for special appointments and real-time blood pressure monitoring throughout the process. Currently, clinics set the blood pressure limit at 150/90, safety first. But even if your blood pressure plays nice before your dental adventure, there's no guarantee that everything will go smoothly. Especially during tooth extraction, the pain and stress can send your blood pressure skyrocketing like a rocket launch. That's why it's crucial to have a stellar dental practitioner who pays extra attention to these details. Private dental clinics often have fewer patients, allowing the dentists to take their time and cater to your needs. That's precisely why my mom opted for a private dental clinic for her implant journey. Especially for someone like my mom, who's one fiery Leo with emotions that can shift like a roller coaster. She relies on various self-care and holistic therapies to minimize the use of medications. However, every time she goes to the dentist, she has to take anti-hypertensive medication in the venture and take preventive measures. Yet, sometimes it feels like it's impossible to be fully prepared for all the unexpected situations. So, due to various unpredictable factors in the real world and also in the quest to find a dental clinic with satisfactory conditions, my mom's dental implant journey has been a long and winding road. She persisted with only half side of her teeth while eating, even to the point where her face started looking like a bit asymmetrical. Finally, she mustered up the courage to make the decision and settled on this German brand clinic. Choosing it was partly influenced by the allure of the German management and technology national brand, and also because a friend had previous positive experiences with this clinic. However, this time my mom was assigned to a male doctor who is considered the clinic's top-notch domestic practitioner. Before making the payment, I scoured the internet for reviews of this doctor. There weren't many, but they were all positive, so we decided to go ahead and have him treat my mom. The initial few months went relatively smoothly. The tooth extraction made my mom quite nervous, but the male doctor displayed impressive skills. The clinic's medical assistants and nurses took great care of my mom and had excellent attitudes. It turned out to be a lot easier than we had imagined. Even when during the days waiting for the suture removal, there was a nerve-wracking incident where a temporary healing abutment became loose and almost fell down her throat. Thankfully, due to the direct communication via WeChat with the male doctor, he explained the situation, reassured her, and promptly resolved the issue. So my mom understood that such occasional incidents were inevitable. So as long as they were handled properly and promptly, she was relieved and didn't pay too much attention to it. The rest of the process went smoothly, with only the final step of fitting the dental crown remaining. My mom even planned ahead if everything went smoothly from start to finish, she would consider getting another tooth implant at this clinic. That alone speaks volumes about her satisfaction. But then, in the final step of fitting the dental crown, when everything seems to be going smoothly, I got my mom's phone call. Told me that she had collapsed in the clinic due to high blood pressure. I wasn't in Beijing at that time, and it was difficult to find family or friends to help immediately, with my mom's blood pressure reading of a dangerous 190. Even after taking antihypertensive medication, this was no joke, and it truly scared us. Fortunately, there was an experienced head nurse who helped lower her blood pressure, and gradually my mom regained her composure. It was only then that I pieced together the whole story. So, as it turns out, the last 2 times my mom went for her dental appointments, she wasn't treated by the male doctor we had initially chosen. They switched him out with a substitute. My mom had always been concerned about the doctor's personal experience, especially when it came to fine adjustment tailored to her specific needs. We were aware that the medical field often substitute experts with interns. So my mom always made it clear that she would only see the assigned male doctor himself. If my mom couldn't secure an appointment with him, she would rather reschedule. During the treatment process, there was a male doctor on the other side who had a similar physique and wore a large mask. My mom politely called out the name of the male doctor she made an appointment with before speaking, but this doctor didn't respond. He would only give brief answers to specific questions or sometimes avoid answering altogether. He tried his best to remain silent, so my mom never realized that they had pulled a swap, and it wasn't the same person. It was only during the final appointment for fitting the dental crown, when everything seemed straightforward and simple, that my mom called out the male doctor's name again to seek his opinion on whether the other side of her mouth was suitable for implants. It was at that moment the substitute male doctor suddenly confessed, "I am not that doctor you asked for." What? Wasn't this a clear case of commercial fraud? Not only were we deceived, but now my mom had doubts about the substitute doctor's qualifications and whether the last 2 appointments met expected standards. Did they consider all the details she had discussed with the original doctor? In an instant, all the trust vanished, and every step of the previous process was called into question. Add my mom's fiery temper to the mix, and her anger skyrocketed, causing her blood pressure to soar. And that's not all. When she left the treatment room and wanted to find a sofa to rest on before confronting them, there were sofas right outside the consultation room. But a young assistant nurse who accompanied her refused to let her sit and insisted on walking around. My mom said to him that she couldn't walk anymore, but the nurse just ignored her and kept dragging her around in circles. Finally, the nurse made my mom sit on a hard bench tucked away in a corner and said, "Rest for 10 minutes and you'll be fine." My mom asked, "Why should I sit on a hard bench when there's a sofa right there?" The assistant nurse was brutally honest and said, "Because there's a camera over there. We cannot let you lie down. Inappropriate footage should not be captured." Can you believe this? Is this even a hospital? Do they have no knowledge about patients with high blood pressure? Is it more important to have harmonious surveillance than to consider the patient's condition? Is there no humanity left? No wonder my mom's blood pressure skyrocketed to 190. Finally, after my mom struggled to strongly condemn their behavior and fought for her rights, they then transferred her to a sofa in the basement, where the air conditioning was blowing cold air, and her hands and feet turned icy cold. All she felt was helpless and anger. It wasn't until the experienced head nurse appeared, adjusted the air conditioning, brought her a blanket, and with the firepower of 2 hearts, as she was pregnant, comforted my mom and chatted with her to ease her mind. She kept rubbing my mom's hands until they were completely warm. The original assigned male doctor, fearing a big scene, also came over and apologized sincerely. Only then did my mom gradually regain her composure. She couldn't take additional antihypertensive medication in the meantime because if the dosage went too high, it could easily lead to low blood pressure. It is a delicate balance to maintain. Eventually, this incident was temporarily resolved. My mom decided to reserve her right to discuss the matter further once her physical condition improved. The original male doctor also promised to take responsibility for any adjustments or redoing if issues were found during the follow-up examination. However, trust is truly a binary concept. Either 100% or 0%. Once it's broken through deceit and deception, there's no going back. My mom has a quick temper, and I don't know if others would get as furious in similar situations. But for people with a hot temper, it's not easy to control themselves with reasoning because they understand the logic behind it but still have to explode when faced with certain situations. It'd always been my advice to my mom that in this deteriorating world, where we would encounter countless frustrating incidents in the future, if you can't control your temper and you have to explode first, then you should at least prepare some methods to calm down afterwards. When there's no others to help, self-massage on specific acupoints can also be effective. But finding a knowledgeable nurse like the one I mentioned is hard to come by. Then my mom requested that, as an elderly person, she has limited mobility to perform certain actions, especially when she's experiencing a high blood pressure episode. So she needed simple methods that are easy to remember and focus on the key points because she can't remember too many details. Therefore, even though our body has various acupoints for releasing anger and lowering blood pressure from head to toe, I skipped the lower body acupoints that require bending or raising the feet. Here, I will summarize 6 acupoints on the head, upper body, and hand that even while lying down, they can be self-massaged without any hustle. The first 2 acupoints are the ones people subconsciously will massage at times when there are certain symptoms. The first one is the temple. When we have a headache, we naturally press our temples. When we are angry, the temples might throb along with the anger. Massaging the temples can relieve fatigue, refresh the mind, and alleviate pain and dizziness. When massaging during anger, it is important to apply even and gentle pressure, focusing on comfort. Remember, we are angry at others, not ourselves, so don't be harsh on ourselves when massaging the acupoints. The second acupoint is Shanzhong, an acupoint for soothing qi. Located at the midpoint of the line connecting the 2 nipples, Shanzhong is commonly known as the vent anger acupoint and can be pressed to dissipate resentment when angry. It governs a person's emotions, and pressing it multiple times can disperse the frustration in one's heart and improve mood. People will naturally massage this area when they are angry even without any TCM knowledge. There are 3 acupoints on our head that we can massage when we are angry: the temples, fengchi, and jiaosun. Apart from the temples that we naturally press, there's fengchi, which can release energy from the body and relieve emotions in a shorter time. It also helps with headache and dizziness. Fengchi acupoint is located in the neck, just below the occipital bone. Another acupoint is jiaosun, which is easy to find. It is located right above the tip of our ear when the ear is folded. Some people may hiccup after massaging jiaosun, indicating that the acupoint has been pressed correctly and is having a certain effect. In addition to the acupoints mentioned, there's the armpit, the starting point of the heart meridian, also known as jiquan. In TCM, jiquan is considered an acupoint for heart protection. Regular massage of this acupoint helps keep the qi and blood flowing smoothly, nourishing the heart and lungs. When experiencing symptoms like chest tightness and shortness of breath during anger, pressing jiquan can help alleviate them. Deeply insert your hand into the armpit and apply some force to feel the sensation of a stripe. At this point, you can hook and press the acupoint with your fingers, but avoid being too forceful. It is remembered to perform this technique continuously, around 10 times per side each time. Lastly, there's the Hegu acupoint, also known as the tiger's mouth, which can be used whenever you're feeling very uncomfortable, dizzy, and cannot recall any other acupoints. Hegu is a versatile and widely used acupoint. Among all the acupoints in our body, Hegu can be described as having the widest range of therapeutic effects, even to the point of being called a cure-all. While this statement may be exaggerated, it does highlight the effectiveness of Hegu. Pressing Hegu acupoint can improve coronary blood circulation, lower blood pressure, calm the nerves, and also help with emotional relief. Hegu acupoint is easy to find and press. The force should be moderate, and the duration of massage can be around 5 minutes each side. In addition to these 6 acupoints for emergency situations, there's a little trick that can be used when you're about to get angry, suitable for those with less explosive tempers who still have some control. If you have enough time to self-regulate, you can try this method. When you feel the anger rising and want to prevent it from erupting, quickly dig into the palm of your hand at the Laogong acupoint. When we make a fist, the position where the fingertip of the middle finger points is the Laogong acupoint. Use the index or middle finger of the other hand to dig into the Laogong acupoint and apply downward pressure for 1 to 2 minutes each side. Try doing this whenever you feel close to getting angry. It can help calm your mind and extinguish the anger. But for someone like my mom, I doubt she would remember the Laogong acupoint in those situations. So for my mom, when she's too angry that she could only stay lying down, I just hope she'd remember the 3 acupoints on the head, 2 on the upper body, and 1 on the hand, which she could easily massage herself using her leftover strength without sitting up. In times when you're overwhelmed by anger and experiencing a surge in blood pressure, it is crucial to utilize the self-help methods provided by our body's emergency pill and anger relief acupoints to the best of our ability and to stabilize ourselves first, without relying on others. Anger only harms oneself and has no real impact on the person who caused the anger. So it's best to avoid getting angry if possible. I hope none of us have to resort to the methods mentioned above, but in case we do get angry, I hope they can be of help to everyone.
In this video, I share my personal experience and insights. I recommend trying these techniques as complementary therapies. However, if your condition is severe, please seek timely medical attention. Join me as we learn how to apply the principles of TCM to our everyday lives and live a happier, healthier life. Please like, share, and subscribe. Thanks for watching, and see you in the next one.